So, welcome to Care at Home Safe and Dignified Care. Welcome, everyone. My name is Susan Prosser, and I'm the Provincial Coordinator of Education at the Alzheimer's Society of BC. And I'm here today with my colleague, Kate Landreth.
Hello and welcome. I'm Kate Landreth, the Education and Learning Lead with Family Caregivers of British Columbia. And we would like to welcome you to our webinar, Care at Home, Practical Tips for Safe and Dignified Care.
Family Caregivers of BC and the Alzheimer's Society of BC are pleased to present this webinar. We are both nonprofit organizations who are supported by the BC government in different ways. It's important to know that we do not work for the health authorities or make decisions regarding care services. So today we have quite a bit on the agenda. We will be learning about maintaining skin health, practicing safe transfers, and safe turning. And we're going to close our time today with strategies for caregivers who provide personal care. We have a lot of engaging content to share with you today. Thank you for tuning in. We've got the PowerPoint slides to share with you, as well as some discussion with our 3 expert panel members. And I'd like to introduce them now. Let's start with a warm welcome to Christy Jervis. Christy completed her Bachelor of Science in Physiotherapy at the University of British Columbia. She has worked in a variety of care settings in Vancouver Coastal Health and Fraser Health. She is the physiotherapy clinical lead for Fraser Health Authority Seniors, Community, and Complex Care. I had to practice that one, Christy. And she was previously the chair of the Vancouver Coastal Health Regional Interprofessional Skin and Wound Committee. Christy helped to plan and coordinate the Take the Pressure Off Skin Injury Prevention Fair at Vancouver Coastal Health for 3 years. She takes a preventative approach to patient and client care, and that's why she is so valuable to us today. She seeks to educate and empower clients and caregivers to optimize their quality of life and to avoid preventable issues. So we're so fortunate to have Christy with us now. Next, I would like to welcome Lisa Perlitz. Lisa has been working for Island Health in home and community care for over 20 years. She started as a care aide and then about 12 years ago became an MSIP coach. Now, MSIP stands for Musculoskeletal Injury Prevention. Now, MSIP program supports a safe work practice on the job. It starts with good body mechanics. And lucky for us, we will be learning some of these techniques during our webinar. Finally, our third panel member is Holly Tang. Holly completed her Master of Science in Occupational Therapy at Queen's University. She worked in a variety of care settings in Ontario before moving to beautiful British Columbia. Her current role as the Occupational Therapy Clinical Lead for Fraser Health Authority Seniors, Community and Complex Care gives her the opportunity to support home health occupational therapists, to educate other team members, and also to advocate for client needs and service gaps. So very special welcome to Holly and to all of you.
The information we are sharing in this webinar will be helpful to any caregiver looking to the future, wondering about the care needs that might arise. And our discussion today will be immediately helpful to a caregiver who is already connected to home health and working with the team to address more complex care needs in the home. Family caregivers are always learning, adjusting, planning, and organizing. And we're going to start our conversation today with Holly. Holly, would you like to talk a little bit about the caregiving experience and how home health fits into the journey of safe and dignified care?
Absolutely. Thank you for the introduction, Susan. While I'm an OT, I'm also someone's daughter, someone's mom. I caregive for my aging parents, and my caregiving journey is not going to be the same as our audience. Our loved ones are also on a journey of their own. Some are in their earlier stages of their diagnosis, while others are in the middle or the later stages. And within each stage, as caregivers, we're going to experience some great days where we think, we got it. I got a good handle on this. And then other days, we're kind of feeling like the weather today. a little bit wet, a little bit cold, maybe even feeling a little bit isolated. And while my journey right now doesn't include home health services, I do see home health services being part of the journey. It doesn't replace any of you at all. We're not here to make those decisions for you, or rather, we're part of your journey. And, home health services may include occupational therapy service, physiotherapy, nursing, home supports. It allows for you to have a bit of a breathing space to allow you to be the wife, be the husband, the son, or the daughter, or even the friend that you also have a role in doing. Um, what else did I want to say? Working the system, I know it's not a perfect system. It's not for everyone. But we are here, as I said, to support your goals of having your loved one be at home. So we're here to walk that journey with you. Sometimes home health services may be at the beginning of their journey and then bouncing back out and then rejoining your journey again as in later stages of your journey.
Thank you, Holly. You described the journey of increasing care needs and variations of that. So as caregivers devote more time and energy into the caregiving and caregiving journey, they sometimes forget about their own needs and their own health and well-being. Yet family caregivers play a very vital role in supporting people to stay at home in the community, and providing care to a family member or friend can be demanding. It can be very emotional, mentally and physically, financially. It can impact all levels of a caregiver's health. How do you discuss the importance of balancing self-care and caregiving with your clients?
When I talk to family about balancing self-care and caregiving, I tend to start with reminding them that they themselves need to be healthy in order to carry on in this journey. Then I like to use my cup analogy. If anyone has a cup of tea or coffee next to them, you can have a look at it right now. You'll see there's only so much volume in one cup. And if you keep adding and adding and adding, what happens? It spills over. So that's one part of the analogy. The other part is regardless of whether you take two sugars, two creams in your coffee, we all have this perfect cup of coffee or perfect cup of tea or the perfect tasting cup of tea or coffee. When you add too much of something, then it doesn't taste good. And that I'm matching that analogy to making sure you carve out time for yourself, whether that is a phone call with a friend, stepping outside, even on a rainy day for 5 minutes, smelling the fresh air, smelling the new blossoms that are going to be coming. It's all part of a perfect recipe for that cup of coffee or tea. Adding too much of something, you're going to go the opposite way. And some may say to me, it's like, well, but I don't add sugar or milk. I like it black. Even if it's a black tea or coffee, if you add too much water, or if you add too much coffee beans, I don't drink coffee, it can taste either too bland or too bitter. So please think about that, and that perfect combination is where we're looking for that balance that you need to give yourself. Life is never going to be perfect, but we can aim for that. That's my answer. And actually, before you start, I'm going to ask our audience to help participate in an experiment that we'd like to do. I'm going to ask our audience to sit really, really still for the next few minutes. Back to you, Kate.
Thanks, Holly. And thanks for touching on what I think I heard you say is around that just self-awareness. We're all different and we all have our perfect balances. And being self-aware as a caregiver is so important. So family caregivers at BC and the Alzheimer's Society of British Columbia both recognize the need to build a care team that includes, but is not limited to, home health. So both of our organizations work with caregivers to help them consider the big picture of care. So today we have been describing caregiving as a journey, knowing that the journey can last years and sometimes over a decade. Having multiple forms of support is really necessary. Holly, just before we wrap up, is there anything else that you'd wish to add on?
No, I think that The only thing that comes to mind is that there are resources to support everyone and not be afraid to take that step into exploring.
Thank you. Thank you so much for your insights. And just like Holly has explained, in our organizations, both of our organizations know that caregivers really need to take good care of themselves. Okay, we will now introduce Christy's topic, the importance of skin health. And I believe Lisa will also be sharing some of her expertise in this matter as well.
Thank you so much. One thing we really want to highlight for all of the information we're sharing today is the information in this presentation is very general. It's not a medical recommendation for your personal situation or that of your loved one. So if you've already been given information by your healthcare team, please follow those specific instructions. So when we look at keeping our skin healthy, we know that you would like to prevent your loved ones from developing wounds. And one key strategy is to encourage them to remain mobile and active as much as possible and as long as possible. This is because activity and exercise keep the muscles strong enough to be able to move around and change our positions effectively. Activity also enhances blood flow to our brains. So we suggest that you consider the Alzheimer's Society Minds in Motion exercise classes. They have them online or in person, and it's a great opportunity for your loved one to get some exercise as well as form some social connections that are so valuable for them and for you. Or if you would like to find another exercise class in your community, but you're not quite sure which one to pursue, you can call 811 and you can speak to an exercise physiologist about activity and exercise options in your community. Here we have information about pressure injuries. A pressure injury is an injury to the skin and the tissues underneath the skin. This happens when too much pressure is put on the skin for too long. This constant pressure cuts off the blood and nutrient supply to the skin and the tissues. The chart that you can see on the screen here shows you the early warning signs to look for. If you know your loved one is at risk for a pressure injury or is developing a pressure injury, you can look for ways to offload or decrease the pressure in order to keep the skin intact and avoid an open wound, which is painful and may be difficult to heal. If you notice that your loved one has these early warning signs, please consult an occupational therapist or a physiotherapist or a nurse for individualized advice for your loved one before the pressure injury progresses and gets worse. You can look for changes in skin color, such as red, purple, or blue-black skin. You can look for rashes, dryness, or swelling. Look to see if the skin is shiny or if it has blisters or cracks or scabs. When you touch your loved one's skin, feel for warm areas or skin that's harder or softer than normal. Notice if there's swelling over any bony areas. And observe if your loved one is experiencing pain or tenderness when you touch certain parts of their skin, especially if that skin is red. So, our best defense against a pressure injury is positioning and repositioning appropriately. We recommend major position changes every 2 hours and minor position changes approximately every 15 minutes to take the pressure off those bony areas. Now, if you were able to follow Holly's instructions and sit still for this whole time, you may observe that you're feeling a little bit uncomfortable. Maybe your sit bones, which are the bones that we sit on, maybe they're feeling a little bit uncomfortable. Maybe you couldn't even last that long and you already started squirming and moving around in your chair. So, for those of us who are able to move around independently, we automatically move and change our position quite frequently. Consider if your loved one is not able to move on their own, and maybe they need either cueing to move or maybe they need a little bit of assistance to move. If you're able to effectively help them change their positions fairly frequently, you can help prevent some of these pressure injuries and other wounds. So in our slide that looks at sitting in a wheelchair or in a regular chair, whenever your loved one is sitting, please encourage them to sit in the correct position at all times. This means that their head is over their pelvis, Their hips and their knees are bent to approximately a 90-degree angle. Their feet are on a supportive surface, like a footrest on a wheelchair, or their feet are resting on the floor. This will mean that their feet are not dangling because the dangling may cause them to slide forward and put pressure on the bony parts of the that are not intended to bear that pressure. Their spine should also be in a neutral position, as straight as possible. Now, if the person is sitting as far back in the chair as possible so that their buttocks is touching the back of the chair, this helps line everything up appropriately and helps them to be in the best possible position to avoid any pressure injuries, as well as avoid pain and discomfort. Then remember to cue them to make those minor position changes approximately every 15 minutes as able. One of the resources that we're going to provide to you after this webinar is going to be a one-pager on how to shift weight in your wheelchair or in your regular chair. Weight shifting allows the blood to flow freely through the tissues to help prevent wounds. If your loved one is able, ask them to stand up frequently. If they're not able to stand up and they are remaining in the wheelchair or a regular chair for a long period of time, ask them to do some of these shifts in positions. If you can ask them to lean forward or side to side, even small shifts in position can redistribute the pressure significantly. Now, when they first start doing these weight shifts, you may want to stand in front of them or beside them to spot them until they learn how far they can lean without leaning too far and sliding from the chair. Here on this slide, we have an example of someone who's leaning forward. They're holding the position for approximately 30 seconds, and this helps take the weight off of their buttocks. Note, for safety, this should be done on a level surface with the wheelchair brakes set. And on the next slide, we have an example of someone leaning to the right or leaning forward and to the right. And then in the next slide, we have an example of someone leaning to the left or leaning forward and to the left. If your loved one has redness on their sit bones because there's still too much pressure even after they do these weight shifts, we recommend that you ask a healthcare professional what type of cushion is recommended to help relieve the pressure. Cushions can be made from different materials for different pressure relieving qualities, and some examples are foam, gel, or air cushions. And if you need a little bit of support in choosing one, you can ask your healthcare professional. When your loved one is lying in bed, make sure that they lay tilted on their side with their hips and their shoulder tilted back about 30 degrees, as you see in the diagram on the right-hand side. You can use pillows or wedges to maintain this position. Encourage them to change positions approximately every 2 hours unless you're told differently by a healthcare professional. Now, we know that getting a good sleep is really important. So if they are able to sleep through the night without changing positions and this doesn't impact their skin, then you don't need to wake them up for turning. But if they are having significant red areas after lying in the same position for many hours, then consult your healthcare professional on what you should do to minimize that redness and protect the skin. If turning in bed is not enough to relieve the pressure and your loved one is still experiencing reddened areas, they may benefit from a specialized mattress. If this redness persists despite regular repositioning and turning, please consult a healthcare provider. You may need to speak to an occupational therapist. Often people will raise the head of the bed to try to visit with others or to change their position. But raising the head of the bed greater than 30 degrees may cause skin damage to the lower spine. So we recommend that you only raise the head of the bed higher than 30 degrees when eating or drinking, or to help get out of bed unless you've been instructed differently by a healthcare provider. Ideally, we do want people to eat and drink while they're sitting in a chair rather than in the bed. But if your loved one does eat or drink in the bed, you will need to raise the head of the bed greater than 30 degrees to protect their airways. If you do this, if you raise the head of the bed greater than 30 degrees, make sure that the person is in the right place in the bed first so that their hips line up with the bend in the bed. Then raise the foot of the bed first before raising the head of the bed. This is to avoid sliding down in the bed, which can cause damage to the skin over the lower spine. When someone spends a lot of time in bed, it's easy for them to develop wounds on their heels. To avoid these wounds, you can offload the heels with pillows or therapeutic small devices like wedges or boots, and we'll talk about those in just a moment. You can use pillows to alternate between the positions you see on your screen. So on the top, we have someone lying on their back, and then you can have them choose alternate side lying. So lying on their right side for a little while, and then lying on their left side for a little while. You can alternate between these positions unless you're told otherwise by a healthcare professional. Now, make sure that the heels or other bony areas don't contact the mattress and don't contact other bony areas. For example, you see in the bottom picture that there's a pillow between the knees and a pillow between the bony parts of the ankles. This prevents wounds from developing in those areas. And in the top picture, there's a pillow underneath this person's lower legs. This prevents the heels from contacting the mattress in order to prevent a wound from developing. Now, if pillows are not enough to protect the heels, for example, the individual moves around too much for the pillows to stay in place, consult a healthcare provider, particularly an occupational therapist or a physiotherapist, regarding therapeutic small devices like wedges or boots. You can see by the pictures on your screen that there are different wedges that help support the lower leg so that the heel does not contact the mattress. There are also boots for individuals who move around a lot so that the heel does not come in contact with the mattress. When you're making the bed or setting up the wheelchair for your loved one, please use the fewest layers of linen underneath them. Use only the cushion or the mattress cover that's provided, and only use a single sheet over top of the mattress. Avoid extra linens or soaker pads since the extra layers decrease the therapeutic properties of the cushion or the mattress that your loved one is using. This means that that cushion or mattress cannot do its job of protecting your loved one's skin because there are just simply too many layers in between. And keep those linens smooth without wrinkles or folds. You want to help keep balanced moisture control for your loved one's skin. Skin that is too wet or too dry is fragile. Fragile skin is more at risk for injury. So keep their skin clean. Wash with warm, not hot water using a mild, unscented soap. Dry their skin gently without massaging the skin over bony areas. And pay close attention to areas that may be wet, such as between their legs and skin folds. Apply moisturizer to dry skin, but use moisturizers that are fragrance and alcohol free. And help your loved one to toilet regularly using the adaptive equipment and clothing that will be recommended later in this webinar.
Thank you, Christy, for sharing that. And now our little Q&A together. There are so many great options when choosing equipment. Could you talk a little about where to find this equipment and how home health can help with the decision-making process? For example, renting, buying, or borrowing.
So you can choose to purchase any medical equipment that you want with or without input from a healthcare provider. You can obtain equipment from the following options, but this is not an exhaustive list. So there are reputable medical supply stores in most of our communities. A lot of people order off of Amazon.ca. And assistlist.ca is a website that helps facilitate the sale of secondhand medical equipment. So those are all options. If you know what you want and you are prepared to make the purchase without input from a healthcare provider. Now, if you're unsure what equipment to rent or purchase, then you may want to reach out to a healthcare provider. And you can do this at any point in your healthcare journey. It doesn't have to be contacting a home health clinician. There are a lot of different opportunities to get input and get advice. For example, if your loved one is in acute care in the hospital, you can ask to speak to an occupational therapist or a physiotherapist for advice on mobility aids or any other medical equipment. But if you are already at home, then what you can do is you can go to a private physiotherapy clinic or hire a private occupational therapist or physiotherapist to come to your home to make recommendations on what kind of equipment would make it easier for your loved one. We can provide a couple of web links to help you find a clinician in your community, whether you're looking for a private physiotherapist or a private occupational therapist. Or you can call your health authority to ask for a home health occupational therapist or physiotherapist to do a home visit, and they can make home safety and equipment recommendations. Just a note for you to be aware of, home visits are typically for clients who can't get out of their home to attend a clinic, and there may be lengthy waits in some communities for this service. So if possible, in order to prevent delays, ask your questions when your loved one is in the hospital already or go to a private clinic. So if you do have a health authority clinician, which could be an occupational therapist or a physiotherapist or a nurse, if they make recommendations on equipment, they can help you borrow equipment short term. And then if you decide you need that equipment long term, then they can help you figure out how to acquire it long term, whether you're purchasing it or whether you need to apply for funding to one of the funding agencies.
Great, thanks, Christy. And how do we help to ensure that the person that we're caring for is comfortable? And then also how we might know when they're uncomfortable, because sometimes communication skills are changing with our care recipient and they can't always express their needs or their pain clearly.
Yeah, there are a number of ways we can identify that someone is in pain. And then, of course, if we suspect or know that they are in pain, then we want to find ways to manage that pain. So just start simply by asking your loved one if they have pain. Ask simple yes or no questions and ask them to point where it hurts. Make it as simple as possible. We also suggest that you consider their pain history. You have known them for a long time, so think about pain they experienced in the past. For example, any traumas, injuries, or falls they've had in the past, and how this might still be impacting them today. Think about their coping strategies or comfort measures they used in the past when they experienced pain, and think about what treatment was effective in the past, and then you can try that today. Think about how you've observed them in the past to have how their pain impacts their sleep or their mood or their behavior or their activities of daily living. Whenever possible, identify sources of pain and discomfort. Um, so whether you're identifying the sources or whether you seek help from a healthcare provider, you want to try to identify potential sources of pain such as acid reflux, recent surgery, arthritis, wounds, recent falls, fractures, infections, or constipation. A lot of people with dementia or other cognitive impairments have difficulty expressing their pain, but they still experience pain. And so think about what other conditions they have that may be causing that pain. If somebody's had arthritis for many years, just because they're not telling you they have pain from the arthritis now, they probably are still experiencing that pain, and you want to treat and manage that pain and prevent it from causing them significant distress. Now, if they weren't able to answer your yes or no questions, they weren't able to point to where the pain was, there are some screening tools that we can use in patients with mild to moderate cognitive impairment. And I believe Susan's going to share with you the Wong-Baker Faces Pain Rating Scale. It's essentially a pictogram where somebody can point to the face that shows how much pain they're in. And so there's a smiling face that shows that this person's not having any pain at all. There's a frowning, crying face that shows that this person is experiencing a lot of pain. If your loved one is able to point to which pain they're experiencing, this helps to communicate to you where they're having or how much pain they're having so that you can advocate for pain management. If they are able to answer a numeric rating scale, then you can ask them on a scale of 0 to 10, 0 being no pain at all, 10 being the worst pain they could imagine, how much pain they're having. And again, then if you know that they're in pain, then advocate for pain management for them. Now, if your loved one has more advanced cognitive impairments, then if they can't describe their pain and they can't answer these questions that I've suggested, then we look at their behaviors to indicate whether or not they're experiencing pain. And so the three main discomfort or behavioral indicators are facial expressions, verbalizations and vocalizations, and body movements. So if you think of somebody's facial expressions, are they grimacing? Are they frowning? Any of those kinds of expressions that might indicate pain. Their verbalizations, vocalizations, are they moaning and groaning? That's a key sign that they're experiencing pain. Their body movements, if they're writhing, if they're wringing their hands, some of these are things that indicate that they're in pain, and then we want to make sure we're treating the pain. Some additional indicators include changes in social interactions, changes in routines or activities, and changes in mental status. Responsive behaviors may be an indicator of pain, so always assess for basic needs such as toileting, thirst, hunger, and constipation to try and make sure that we're meeting their needs to avoid some of those responsive behaviors.
Great. Thank you, Christy, for helping us better understand the importance of skin health and pain management. Lisa is now ready to help us understand more about safe transfers.
Thank you very much, Kate. So I would like to speak on the people providing the care for their loved ones. It's important that they keep themselves safe while trying to provide this care. So one of the things that we often use is stable. So it is to keeping your natural curve of your own spine. So how you're standing, you can stand up against a wall, put your hand behind your back, and just see where you're naturally standing. That is your curve. With your head up, eyes forward, chest up, and butt out, not sticking way out, just naturally. And to avoid twisting at your trunk. That is going to make you hurt your lower back. You need to be facing the direction that you're going to be working in. A good way to keep this to happen is keep your toes in the same direction you're going. And keeping your arms in close with your elbows at your sides, because as soon as you have your elbows away from your body, you will be overreaching and your load, whether you're helping someone stand up or picking something up, it increases your chance of getting injured. Having your good base of support, your feet shoulder length apart, one foot a little bit in front of the other, so that you have the staggered stance, so you are steady. So helping someone move or reaching for something, you're not going to topple over yourself. Using your legs to lift or move, shifting from at the waist, at your hips, keeps your arms and trunk in a good position. So it is not, so you won't be overreaching. And evaluate your load. Make sure what you are moving or lifting is within your capacity. We always recommend not to go over 30 pounds. And make sure you have enough room to work in. If there is side tables, there is rugs in your way, make sure you have a clear path and workspace. Now, having a good stable posture for your body can help you avoid risks, awkward posture, overreaching, doing something over and over again, repetition. These are all things that could cause injury to your own body. Contact stress is where you're pressing up against something that is hard surface with your, leaning on the bathtub or leaning over a rail, a bed rail. Those are, if you have to do something like that, putting a towel or a cushion there so it's not your body up against the hard surface. Excessive force. When you have to push or pull a wheelchair, making sure that the wheels are going in the right direction can minimize that hard start push that you need to do to move someone from one place to the other. Static posture is where you're holding a pose for any length of time. Say you're holding someone's leg up, or you're holding, that tray that you're may possibly be feeding a loved one from. Holding it for more than 30 seconds can increase the chance of injury to yourself. So this is some of the things that you can go over. It's a pre-handling safety check. And you're going to help your loved one move from one place to another. Going over some of these to make sure that they are able to help you with the transfer. Having your loved one do the, participate in this. So you're going to look at assess the person each time you're going to do this, because you want to make sure that the transfer is going to go smoothly and there's not going to be a chance of them falling. So you're going to check the environment, make sure there's no tripping hazards, the height of the surface that they're transferring from one surface to another is you're not going too low or too high. Making sure the brakes are on, they got good footwear, a transfer belt, and have a plan. Communicate this with the person that is your helper or the person, your loved one that you are actually transferring. And preparing the person, make sure their feet are in good position, their hands are where they need to be able to push off or grab onto a solid pole to pull themselves up. Make sure they're sitting closer to the edge of their seat so they're not too far back. And when I talk about feet positioning, a little bit of a staggered stance for them with one foot back a little bit. So, when you're getting up, it's easier than trying to sit from a 90-degree. And then prepare yourself and then proceed with the transfer. So we're just going to watch this video.
Rolling a client in bed. This is a movement that occurs frequently throughout the day and throughout the shift. It's important that you do it correctly to protect yourself and the client. Firstly, we need to set up the client in the correct position. You want to take the arm that you're going to, on the side you're going to roll them to, and move it away from the body. You then take the opposite arm and cross it over the chest. You want to lift the leg. If they can bend it, ask them to bend it for you. Once you're set up, you then want to take and start the movement with your forearm. Your hands are there to stabilise with a nice broad, flat contact. As the client may be up there for several minutes while you clean and void or placing the slings. You can roll them back. If there is a larger client, the second handler may need to help and assist to get the movement going. At this point, once the movement starts, you place your hands on top of the other hands. That way, you don't compromise any other area. And that's how you roll a client in bed.
So as we saw in this video, this is a good way to roll someone in bed. If you are doing it all on your own and you're at home and you don't have a lot of equipment available. This way you're avoiding the scraping their skin or pulling, rubbing against the surface. It's just a nice smooth roll to not provide or not cause any injury while you're trying to provide the care. If you're not sure on how to do this, you can always ask PT if they're available to show you some of those safe transfer techniques. And they can walk through that with you. And if boosting up in bed, there is this piece of equipment called a slider sheet. It helps so that your hands don't need to be on the client while you are moving them. It has a slippery surface, so it doesn't drag across the bed. It's just sliding nice and smoothly. So this is the slider sheet. It's used for boosting up in the bed. As you can see, there is a darker section in the middle, and there is slippery fabric on that, which that would be on the surface of the bed. The two outside pieces that are a little bit longer, those are used as handles, so to speak, used to slide the person up in bed or help to grab onto something to turn them over. It also can help with wrapping their feet to get their legs in and out of the bed. This way you're protecting their legs and skin without injuring yourself, because you don't need to reach all the way to the floor once it's in place. You kind of scoop it like a basket and then slide them up over the side of the mattress. It can also be used for repositioning in a wheelchair, because it is easy to put under someone. You can slide it in and take it out as needed. So to lie to sit, so when someone's lying in the bed and you need to have them sitting on the side of the bed, and say they can't because they have hurt their shoulder, they can't push off the bed, you're going to need to help them. So a good practice to try is to roll them to the side of the bed with the slider sheet underneath them, and then roll them to their side. And then when they're on their side, you can grab the remote control for the hospital bed. As you start lifting the head of the bed, you can slide their feet off the bed. And then they're almost halfway sitting up. They're still on their side, the feet are off the bed. Getting the feet off the bed almost helps them get to that last little bit of sitting up. Then when they are ready to reach the sitting position, you can take the slider sheet around their shoulders and do a weight shift backwards so that you can sit them up right on the side. So when we're doing a sit to stand with their feet on the floor, and you're sitting on the side of the bed now, and you want to help them stand, to get their feet on the floor, but you can use the bed as almost like a lift chair. So you can raise them up so they don't have as far to stand up from. Have their walker or walking aid or whatever it is close at hand, but not grabbing onto that. If there's a pole or bed rail, they can reach and grab to help stand themselves up. A transfer belt can be used around the waist so that they can grab, so you have something to grab onto to assist them to the standing position. So these are a breakdown of to do a sit to stand transfer from a chair. You're going to make sure the brakes are on. They have good non-slip footwear. Their transfer belt is on, nice and snug around the waist. You're going to slide to the side of the bed, slide to the edge of the seat. They can put their hands on their knees to help push up from. Often pushing up off the bed, the mattress sinks down, and then they try and use their knuckles to get that extra height. And then as a caregiver, you can give them cues on how to get the momentum going. So you can rock back and forth. On the count of 3, we'll stand, having your hand at the lower back or on the back of the transfer belt, and a gentle push to help them stand up. The other hand on their shoulder, so that the front of your shoulder, so that once they are going to stand up, you can help them stand up nice and tall and grab onto their walker. So here's some pictures of a sit to stand. The caregiver is the one in blue, and you can see where her hand position is in picture 1. Their hand is at the top of the shoulder. The other hand is at the lower back. The walker is in front, but the loved one is going to push off her knees rather than grab the walker. The walker will tip over if they're going to grab onto it, and they'll fall back into bed. On the second picture, count of 3, 1, 2, 3, and then can stand up. In this second picture, leaning forward, having nose over toes, will help enable them to start that push off in a easier manner. Once they're up in picture 3 there, they're standing, they're grabbing onto the walker, they're ready to go, whether it is to the wheelchair, and then they can help get seated. Here's some other transfer tips. The bed height should be, when you're providing care, should be between your hips and knuckles. And this is a good height for a worker or to provide care in bed. Regular beds are sometimes really difficult on the back. So putting a knee on the bed helps you get safely to your loved one to provide care in a safer manner. Brings you down to a lower level. Transfer belts are firmly around the hips, and this is an assisted device that is used to more guide into standing up or sitting down or moving, turning while in a standing position. Is not used to as a lift device. We don't use that to pull people up. I would like to say lifting someone from under their arms is often very unsafe. One, we could be pulling on our loved one's arms underneath. It can be very painful. So try to avoid that if possible, using cueing and pushing on body parts to move someone around, or pulling on arms can cause injury to your patient, and is very it's very difficult sometimes for them. When you're pushing on them, they will resist back and push on you. If your loved one cannot transfer safely, then lifts and slings can be assessed by rehab professionals, and they can direct you in what kind of equipment that you're going to need to continue providing care at home.
Great. Thank you, Lisa. When you describe the importance of good body mechanics, I think about the importance of understanding one's own abilities. And it takes some honest reflection in order to safely jump in and provide assistance. And not all caregivers can provide this type of physical support. And I imagine there's a bit of a learning curve. Are you able to expand on that?
Yes, it is very important that family members are providing care for themselves safely. They are the ones providing care all the time, as healthcare professionals are only coming in on certain times, and we need them to provide care the rest of the time. Care needs can be for a short period of time or a long period of time, depending on where the loved one is at their stage of their process. It is a learned practice, so I suggest start out with small steps. Start out maybe picking one and practicing that one, like setting up your work area where you're going to provide care. Make sure that everything is in place and you don't have to overreach, and you're staying within your bubble, so to speak. And being aware of your own body's limitations and knowing when it is time to ask for extra help, because if you're not able or physically able to provide a certain part of the aspect of care, then having someone provide that part that you are unable to.
That's great. Can you speak to cueing as a type of technique? So we know that cueing can be really important, and especially important. It's important, and it can often be challenging as well. So sometimes talking and explaining is not sufficient for a care recipient who is experiencing cognitive or communication challenges. Could you share how a member of your team might provide cueing?
Yes. So besides verbal cueing, you can do gestures, show them what you want them to do, perhaps mimic the move, um, and or hand placement. If you would like their hand on a pole to pull themselves up, perhaps how guiding their hand there, um, having your hand at the small of the back to help stand up, also holding a hand. And when you want to walk with them, just having that. So a lot of times you hold hands, it starts that whole movement, and adjusting their feet position, making sure that their feet are in the right place if we're needing them to go or stand up, pointing or tapping on the place that you want them to sit, um, and or come over here, and gesturing, and maybe doing show them the whole thing that you're wanting them to do before, and then go through it again as you are doing the transfer.
Thank you. That is so helpful to hear. And thank you so much for sharing your expertise on safe transfers. So
Thank
this
you.
is a skill set that caregivers might need to learn early in the journey, and it's crucial that caregivers do not injure themselves when helping with these transfers. The information you have shared, Lisa, will make a huge difference as caregivers endeavor to provide safe care in the home. Let's welcome Holly back. She's going to talk about personal care now.
Thank you. I see in the chat there's some questions around what is a recommended frequency of assisting a loved one shower, and how do you go about that? So I think the next set of slides will help answer some of that questions, I hope. So regardless of whether you're assisting with someone with a shower or helping them get dressed or going to the toilet, it's really important to establish a routine uh, so that they get into a pattern. Um, you may, again, depending on where you are on your journey, you may be able to put it in a calendar where it's visible to say, where you're going to, have a picture of a shower to say, okay, Tuesday and Thursday, we have a shower. It's really negotiated between yourself and your loved one. It could be every other day. Could be twice a week, 3 times a week. Um, so establishing that routine and be staying consistent. And the routine also is if you can stick with the time of day. And I'll get into that a little bit later into some other slides. Getting someone to shower, for example, or to get dressed without conflict. That was the other question. Try to use positive reinforcement, right? For example, Bob, our favorite granddaughter, Samantha, is visiting today. Wouldn't it be great if we refreshed ourselves and are ready for her? And if they're saying, nope, I've already showered this morning, I don't need to shower again. Don't argue, but just revisit that again in 10 minutes, maybe half a day later. Sometimes you just have to say, today's not the day for a shower, even though we want to have that routine. We'll just do it a different day. I know yesterday I was trying to get my mom to an appointment, and early in the morning I was trying to give her some cues, reminding her, we have an appointment this morning. She was adamant, nope, I'm not going. You can go by yourself. I let it go, revisited at lunchtime, and she was a bit more agreeable. Still grudging, but I got her there. I like to use the royal we, and because if you're saying you need a shower, you need to do, it's very directive. Again, most of us want to have some control. So saying we, you're doing it together, usually is a bit more palatable to the ear. And if you're having helping someone with a shower, you want to make sure the room is warm and comfortable. You want to help them feel safe and relaxed. For some of us, this may be the first time that we're seeing our loved one, helping them undress. And so you might feel awkward. And I think it's okay to say, kind of new at this. I'm gonna need your help, Bob. Picking Bob. I hope no one's in the audience with Bob. I apologize. Just an example. Use a handheld shower, because if you think about the sudden of turning on water, it can really startle our loved ones. So having a handheld shower, removing it from the hook, then turning the water slowly so that it becomes warm, would help reduce that fear. And breaking down steps and talking about it. So by that I mean, I don't mean, okay, Bob, we're gonna walk into the shower, we're gonna take off your PJs or take off your top, walk into the shower. That is way too much information. You're breaking down the steps. Instead, you take one or two steps at a time. Bob, let's walk to the bathroom. Can we now pause and then say, okay, we're gonna step into the shower, but let's take off your clothes. And once you're in the shower, you may say, I'm gonna start warming up the water, just the water to sprinkle on your toes. How's that? So as you're doing that activity, then break down the steps for you and let them know what's coming. And for showers, use extra towels. I think now I'm gonna get you to watch a very short clip of a video. It's 6 minutes long, but we're gonna watch the first part only.
ADL stands for Activities of Daily Living, and it refers to all the activities that you and I and your care receiver need to practice, and that includes bathing and dressing. Helping out your loved one with ADLs can sometimes be a sensitive issue because sometimes it can make him or her feel exposed, embarrassed, or vulnerable. If your loved one has dementia, it can also include fear of the activity itself. Therefore, approach your loved one with respect, patience, and in a gentle way. Some things to remember are: go easy and don't rush anything. Create a safe environment. Allow your loved one as much independence as possible as you stand by. Gently talk through all of the steps you're taking. And if your loved one has dementia, he or she may need more prompting and help throughout, so show and tell and sometimes guide his or her hand in the task. ADL stands for
Thank you. I'm going to move on to talking about getting dressed. So a lot of the 8 tips that I talked about in the earlier slide definitely applies here. But I want to highlight a few. One of them is making them feel safe and getting them involved. Like if you have button-up shirts, can you do the top button while I do the bottom button? Offering choices. For example, it's Sunday and you're heading out, you can pre-prepare 2 outfits. It's like, do you want your Sunday best or do you want the new outfit that Samantha got you? But for example, but also try and match their lifestyle, your lifestyle, right? If your loved one always has a white t-shirt, you're not going to offer a pink t-shirt. But maybe it's the type of pants or their favorite pair of pants. So those are some tips, but also you can help with the activity by changing the environment. When I change the environment, I'm like not moving somewhere else, but rather looking at in this case, clothing. Button-up shirts are easier to dress. Poncho styles they're nice and loose. They're also easier to use. If they have a favorite sweater and they've worn it for 30 years, you're going to get a better response. It's more about, changing, like, do they have another favorite sweater so that you say, I really need to wash this. Can you wear this for a few days? Adaptive clothing, there's options here in terms of, if you have the financial resources, absolutely. There's a lot of companies that make adaptive clothing. For those who've said, yeah, I don't have as many resources. Already some of the athletic wear, you can see that there's button-up side, button-up pants, Velcro if you are handy with sewing. Velcro is also OT's best friend. Some Velcro you don't even need to sew. It's like a sticky backing where you iron it back on. So you can actually make your own adaptive clothing, like cutting down a line of a t-shirt and putting Velcro so that putting it on and off is a lot easier. Other things that you can do is using elastic shoelaces or slip-on shoes that have a good sole. There's button hooks and of course shoe horn to help with putting shoes on. Same with toileting. Again, setting up a routine. Now, it's a little bit trickier to kind of set up that routine, right? Because you don't want to be directed, like we said, it's like, well, it's time to go to the bathroom and see if you need to void. Now, you might say, after breakfast or shortly after breakfast, you can say, why don't we take a walk? You don't necessarily have to say where you're walking, but maybe you're passing by the powder room. Bob, we're just right in front of the powder room. Do you think you might need to void? Do you think we should sit on it for a little bit and see? Wherever possible, you want to get them to participate, like walking to the bathroom, maintaining those skills. It's very important, and that part is part and parcel into setting up that routine, getting them into the habit and in their involving them in their own care. Again, using safety equipment, which I'll talk about in a little bit. And again, thinking about what my colleagues or partners have said here today about your own body mechanics, really important when you're helping them with that transfer. I learned something from Susan because she had come to Fraser Health to do a presentation that red is a very visible color. I mean, don't go all go out and buy a red toilet, but if you think about your own bathroom, do you have beige walls, a beige toilet, beige sink, and beige counter? If so, you really want to be able to help your loved one help certain things come out, pop out, or be more visible. So be it a red sticker, or if it's white, you can do a black sticker on the cover of the toilet cover, just so that stands out a little bit. Using bathroom safety equipment, and we have 2 slides in that in a little bit. Before we move on to that, though, I do just a word of kindly, friendly reminder to not go out and just immediately ask for a bathroom renovation. Really consider looking into a healthcare professional's opinion, talking to contractors, weighing out what your needs really are because so many times I have heard client family, they had the best intentions, renovated the bathroom, but they couldn't use the bathroom. So just word of caution there. All right. So some of the pieces of equipment that you may see or hear about is grab bars, floor to ceiling poles. They're really used to help someone go from a sit to stand. Sometimes it's used in a shower. Suction cups have a place in the world, but do be aware it can become loose. You almost need a perfect environment for it to be really secure. So be aware. If someone is not as ambulatory and they're just able to get themselves up, but not able to walk that distance, you can consider a commode, a bedside commode, or you may want to have a toilet safety frame. I'll have some pictures in the next slide. As Lisa has pointed out, when you're helping someone stand up from a sitting position, you really want to make sure their feet is flat on the floor so that they have contact and then be able to push up. Although lift chairs is not really part of bathrooms, generally speaking, it does help with the standing. A lot of them are automated and can help your loved one come up to a standing position. So again, they are great for certain clients. In the tub or in the shower, you may want to consider a bath seat or a bath chair. Make sure you have a non-slip mat. Non-slip mat is great for everybody. I think doesn't just have to be our clients, even for ourselves. I think it's a safety feature that we all should use. And we've spoken about a handheld shower wand because that allows you to move it to the different parts of your body, to different parts of the shower as you need. And here are some pictures of the things that I talked about. So there's a shower chair. You can see there's in the background, there's a grab bar, but in front of it, there's a clamp on grab bar. Toilet safety frame, commode. These pictures actually you can access from Fraser Health, and you don't have to be, it's a patient education catalog that you can search as a bathroom equipment. Appointments, yes, I'm experiencing that quite a bit, is that when you're trying to support your loved ones going to appointments, like myself yesterday, you have to give yourself lots of time. What may be for you 5 minutes, okay, I'm going to plan, I'm going to leave in 5 minutes. You need to make sure that you give them lots of awareness, lots of prep time. Making sure you communicate. Some may say, or I guess I should use myself again. Mom really doesn't like blood work. I have a hard time getting her there. They're not going to remember the conversation. They're not going to remember why it is that they don't like it. What they do is they've associated a negative feeling. And what we have to do is find a memory or a feeling that you don't like blood work, but you also don't like being in the hospital. So between the two, I need you to come to this appointment with me so that you don't go to the hospital. So I have an example there. And then when you're at the appointment, sometimes, doctors run late or appointment times run late. They can get restless. So I love that our technology now has, pictures and you can play music for them. So bring a headset, bring some music. If there are opportunities, you can ask your care provider whether there's mobile clinics. And then last but not least, always offer some rewards. Like yesterday, finally got my appointment done with my mom. She loves fried things. So we went for French fries afterwards.
Thank you, Holly. French fries are the key to my heart as well. I had several questions for you, but I think I'm just going to dive into one right now, if that's okay.
Sounds good. Yeah, absolutely.
And that is something you mentioned about providing personal care and how it's really important to maximize the independence of the person we're caring for. And I wanted to ask you why, because sometimes involving a care recipient takes much more time, much more effort, and certainly much more patience. So I wanted to ask you, why is it important to keep the care recipient involved if it really is going to take so much more work?
Well, regardless of what stage your loved one is in their journey, most of us want to feel that we're useful. We don't want to be a burden to others. And it already takes a lot of trust on their part and love on their part to let us be part of a care team for them. So the more we can get them engaged, the more likely they will be agreeable to the appointments, to that shower. And the other piece is there's research that says, the more you do something, the more likely that it's going to stick. And again, honestly, I think they may not remember the activity, but they remember that feeling and they're going to hold on to that feeling. And sometimes when you're saying, oh, I really need your help. I'm going to hold the water, but I don't have the hands to soap you. I'm going to give you the soap. You do it yourself. And because you know where your itches are. That makes a lot of sense. You might even be surprised and they may turn around and say, I can't reach my toes. Can you help me? Or they may say, I'm really comfortable here. I'm going to just let you do the whole thing. So you don't know where that leads you. And in school, I still remember one of our instructors have said to us that it feels long, it feels like it takes a long time, but there's research done that it may only take an additional 30 seconds. I know when we're providing that care, it certainly does not feel 30 seconds. It feels like 3 hours. So for multiple reasons, I think it's really important to get them engaged.
Thank you so much, Holly.
Very welcome.
We have learned so much. I've learned so much today. Thank you, everybody. This is the end of the formal part of the presentation now, and we have Lori, who has been keeping her eye on the chat box. So Lori, can I invite you to chime in?
Thank you. Yes, it's it's been a wonderfully robust chat box. So thank you everyone for comments, questions. It's been great. And Holly, thank you for noticing that many of the questions you did cover in your section. One of the questions was, I'd like to know what are good men's shoes for inside to prevent slipping?
Hmm.
Anybody want to take a crack at that?
I think things that are not, so with rubber soles, so they're not as slippery. I can picture it. I'm going to see if I can find a picture. So I think my initial answer would be having uh, rubber soles or things that are not slippery, not cloth material.
Great. Thank you. Yeah, rubber soled. That makes sense. My mom tends to hold her head in her hands and slouches. Are there any suggestions to help sit in the correct position? This person doesn't indicate if their mom's in a wheelchair or just in a regular chair. So perhaps if you can make suggestions for both or either one of you.
In terms of helping your mother to sit up more tall and not to slouch, all the recommendations we make today, they are generalized. So sometimes people would benefit from a more individualized approach where they do actually need to see a physiotherapist for more recommendations. But in general, we find that when we get the bottom as far back in the chair as possible, basically it means that then our pelvis becomes our base of support, and it helps line everything up appropriately after that. So much the same way as when someone is building a house, we need a solid foundation upon which to build everything else. When we are sitting, we need a solid foundation, and that really is getting the bottom back as far as possible, getting the hips and knees at approximately 90 degrees, having the feet supported so that they're not dangling. If you can start with that kind of stable position, it typically helps with everything else lining up.
Great. Thank you. My husband's skin is dry and scaly, not cracking, but exceptionally dry. He also gets charley horses in his calf and thigh. He does very little exercise, which I feel contributes to these spasms, but he's in so much pain, he doesn't want to walk any more than necessary. Any recommendations or suggestions?
Again, just generalized information being shared here. Sometimes cramping can be due to dietary deficits, and none of us on the call here are dietitians or nutritionists. And so it's outside of our scope of practice to make recommendations on any kind of mineral supplements or any kind of diet changes. However, that same phone number I gave you earlier to call to speak to an exercise physiologist, 811 is a phone number that you can call and speak to a dietitian free of charge. And they have that in their scope of practice, that's their expertise. So if there is any kind of dietary cause to the muscle cramping, they could give some support on that. Talking to your family physician about it as well to find out what is the physical cause of the charley horses and the muscle cramping. And then in terms of just trying to be as active as physically possible, it's about finding kind of the sweet spot where you can be active and mobile without increasing the pain. And sometimes once we start becoming more mobile, more active, sometimes that helps decrease the pain over time. So it could be choosing a mobility aid, for example, a walker or a cane. Sometimes when we're using mobility aids, that's for less weight bearing through the legs and more weight bearing through the arms. That can help with pain. Sometimes people would prefer swimming. So some of the pools, like if your loved one is able to get in and out of the pool, then the pool is an excellent place to be mobile, but you're buoyant, you're kind of floating. So it tends to help with some of those arthritis related pains and other pains. So I can't give specific recommendation for your loved ones, but those are just a few suggestions to consider. And then if there's like dry, scaly skin, just those recommendations around the moisturizer, like just trying to keep the skin moisturized, but not damp or moist. I hope that's helpful.
Really helpful. But when someone says, my mom refuses to use incontinence briefs, what can I do? How do I encourage one to bathe regularly without conflict? How do I help someone eat healthy foods when they resist, change when they resist? You can see where there's a theme in a lot of these questions.
Yeah, I'll go back to, I don't know that I have the answer, but I certainly am experiencing that myself. Again, everyone is at a different stage, but where you can reason with them, you can say, again, going back to a lot of them will remember the feeling of A over B, like the example that I gave earlier. I know you don't like to get your blood work, but I know that you hate going to the hospital. You hate getting to the point where you're so sick that you can't be at home. So using that as a choice. Yeah, I would say having that to pause and try again at a different date for some of the times in terms of care activities. Um, Incontinence briefs, again, I don't have a straight answer, but something you may want to consider is some of the incontinence briefs now look like underwear. You may want to try a really small sample to see if your loved one would be more agreeable to trying it.
Great.
And ideally, from a skin perspective, we prefer not to use incontinence briefs because if the dampness is in contact with the skin for a prolonged period of times, it causes significant skin breakdown. But we understand why people choose to use the incontinence briefs from a cleanliness perspective and whatnot. So if your mother's choosing not to wear them, would it be possible to create a toileting routine instead that results in her not needing it? So if going to the bathroom every hour means that she's able to remain continent and doesn't need the briefs, then just making sure she has that opportunity to go to the bathroom every hour, that might be a strategy.
Great. So someone says, where to buy locally the jumpsuit with zipper at the back to prevent her taking off the adult diaper at night? And any idea of cost? I'm assuming that would be beyond the team, but any suggestions for where people can look for assistive clothing?
I don't know the cost, but I know that Silverette does a lot of adaptive clothing.
Lori,
Uh,
could I just quickly chime in on something that I
Please.
learned about incontinence brief or incontinence pads? Is that sometimes people are trying to take them off, not just because they don't like them, but they're actually very, very uncomfortable. And so we wouldn't want to introduce an adaptive clothing to keep that very uncomfortable underwear on. So just taking a moment, as I think it was Christy, you were talking about pain, to do a pain assessment. Like, is this clothing, is this item, or is this scenario occurring because something's very uncomfortable or even painful. That's worth going through that process that Christy described.
That's excellent.
Thanks, Lori. Well, I think we will wrap up then. I want to make sure that everybody knows how to contact the Alzheimer's Society of BC, Family Caregivers of BC, and I want to share some contact information for the two health authorities who so kindly joined us today. So you'll see Island Health at the top there. Thank you so much, Lisa. You'll see Fraser Health at the bottom. Thank you so much, Christy and Holly. It's been a real pleasure, and we've all learned a lot from you. And we'll just shift to our next slide, which is all about the Alzheimer's Society of BC. You're going to see that we have support groups, educational workshops. We have a helpline, not only in English, but we also provide service in Cantonese, Mandarin, and Punjabi, as well as Hindi and Urdu. So please reach out. We want to hear from you. And of course, Family Caregivers of BC is a nonprofit charity dedicated to the well-being of family caregivers. So if you're providing physical or emotional care to a family member, a friend, or even a neighbor, and you'd like some access some information or education, this is how you reach the family caregivers. So thank you again, everybody, from all of us to all of you. Have a great day.